Hi, my name is Lori Harrington. I'm a board-certified physician assistant with approximately 20 years practicing in the aesthetic field. Sclerotherapy is a procedure to treat varicose and spider veins of the legs. It is a well-known procedure. It has been used for many, many years. The reason people treat their spider and varicose veins is because we find them unsightly. Living in Florida is obviously an area where we expose our legs more because of the climate. Sclerotherapy is a procedure of injections where you inject a solution into the vein in order for it to shrink down and go away. Most people require a few treatments to get rid of the varicose or spider veins, but it's a procedure done within a half hour. Afterwards, you can get up and do your normal activities that you would for that day. There's no anesthesia involved. The only thing noted is that you will bruise from the procedure, so you have to plan your social life around that for a little bit, for 7-10 days, and then usually have subsequent visits every 2 weeks. The number of treatments required is depending on how bad your veins are in the beginning. Anywhere from between 2 and 6 treatments are usually required. The way we prevent getting varicose and spider veins is trying to maintain normal weight, having a healthy lifestyle, keeping active and exercising. Anything that keeps the calf pumping will prevent more varicose or spider veins from occurring. And at the end of the day, if you work in an occupation where you're on your feet a lot, we do recommend light support hose or compression hose to work on prevention as well. The gold standard for treatment for varicose and spider veins is sclerotherapy, which is a mode of injection, when we inject a solution inside the vein in order for it to shrink down and go away. There are varying solutions you can use to treat the spiders and the blue veins on the surface. Traditionally, there's been Sotradecol used or saline, and now we have a new available FDA-approved drug called Sclera. Sclera has been used in Europe for many years, recently got approved here a couple of months ago, and it is proven to work very well on spiders and blue veins with minimal side effects. And it has an aesthetic property to it, so it tends to hurt a little bit less than some of the saline used in the past. The number of treatments required are dependent on how your consultation is. It's usually anywhere between 2 and 6 visits, approximately 2 weeks apart. There's no downtime with holding you back in your lifestyle, but the only downtime you would consider some bruising of the legs. So you probably wouldn't want to expose your legs with the bruising for up to 5 days to 2 weeks. Mary has a cluster of spider veins right here, and she also has what we call a reticular varice coming up through the leg here, or what we call a blue vein. The blue vein is causing the spider vein. To get the best cosmetic result, we treat both. All right. Little tiny pinch. And I'm injecting right now. As you can see, the blue vein gets flushed. Okay, here we go, little pinch. And you can see it being flushed and clearing. I'm going to do one more over here. Beautiful. Okay. What will happen now, since we flushed the vein, the medication's in the vein, a couple seconds it comes back red and irritated, and then it's a waiting. Then we have to wait 7, 10, 14 days in order for it to lighten and shrink.